What sort of response have you gotten from the public?
Well, first of all, in general, the Ask Get Anything meetings, we've now up to about 50, more than 50 total, have been great. I mean, you know, there's two reasons to do those Ask Get Anything gatherings. One is let people ask about me, what are my values, principles, what do I think about issues. I think that's what voters and citizens deserve. The second is to listen to what people are asking about and what they're feeling. And I think that's the role of a congressman, role of a candidate, and you know, ultimately part of why our society works well. So, but what we've heard, again, is, I use the phrase enough is enough for a reason. What we've heard is people are getting fed up with Congress trying to change everything about American life. Whether it was the stimulus, people don't know why the stimulus was enacted since it didn't create jobs, it didn't help people, at least here in Missouri. Cash for clunkers has been a disaster. Most people now agree it didn't work well and it sort of only accelerated purchases and it cost us billions of dollars. You know, health care, cap and trade, I should say cap and trade in Missouri has captured a lot of attention because of Dave MacArthur and MacArthur's Bakery. But on health care in particular, Nancy Pelosi and her team are taking on, you know, sort of something that is very, you know, different than, say, even just a tax issue. They're taking on what people know to be their health and how they function. And so, you know, she's increased taxes, that's true. She's allocated money in ways that people object to, that's true. But she's also trying to say, look, in the future, your private insurance probably won't be there in the same way. Medicare won't be there in the same way. And people are just saying, wait, stop. Let's do things better. Let's make things better. But let's not junk the American way of life because special interests want to have something passed.
You've mentioned before that you think that there are some reforms to healthcare that
Sure.
are needed in the country. Could you identify maybe 3 or 4 reforms that you'd like to see?
Yeah, exactly. I mean, nobody should sit back and say that things are perfect. They're not perfect in America. They're not perfect as to tax policy. They're not even perfect to civil liberties. We can worry about all kinds of things. We should make things better. Look, as to healthcare, everybody knows that in the last couple of years, probably the last decade, we've seen an increase in cost and people worried about healthcare. But before we say what we should do and some ideas, let's say what's true. American healthcare is really very good. The technology's wonderful, the breakthroughs are wonderful, the care is really great. We need to admit that. Before we badmouth everything, let's be honest with ourselves and each other. It's a good system. It's not perfect. Here's 3 or 4 things we could do today that would change that system. One is, everybody's talked about it, but it's true. Let our states compete against each other for our health insurance plans. You know, so if you want to buy a New Jersey plan that has lots of different mandates, you can buy it. If you want a Missouri plan that has a few mandates, you can buy it. Vermont, California, whatever you want. Let them compete against each other. The federal government, in league with insurance companies, created a kind of monopoly that allowed insurance companies to just sell to Missouri or just Illinois. It's a dumb system. We need to break that trust, get the federal government out of it. Let's just let insurance companies sell wherever they want. That's one thing. We know it would lower costs, would also give people power, would empower them. Second, I think there should be thoughtful healthcare lawsuit abuse reform. Now, I'm not one of these people that runs around saying tort reform is going to solve all our problems, but we know that there are abuses in the system and we should address them in a thoughtful way so that physicians and patients are able to get and give care in a way that is not overwrought by frivolous lawsuits. Another example of something that we should do today, Medicare, Medicaid, and the VA are 3 government-run systems. They are not run well enough. We should make them run better. Fraud, abuse, mismanagement. Let's just make them the envy of the world. They are not today. They're good. They're not good programs. We owe an obligation to our seniors who have paid into Medicare. We owe an obligation to our VA members, our veterans. We shouldn't back off of those commitments. And the poor, when they're stuck, we should have a safety net. But currently those 3 systems are not good enough and we should make them better. And if we did that, we would save a lot of money and we would make a lot of things work better.
Would you say that one way to approach this would be to take those systems and try and turn one or maybe a couple of them into models that we then can then try and duplicate on a national level?
Again, I'm a firm believer, especially, let's start with the VA. I'm a firm believer that we made a commitment to our men and women who have served to provide them a health care safety net. Now, that is true. My wife happens to be a physician and works in geriatrics and has worked regularly at the VA hospital here in the St. Louis area. And what she would tell you is, it's a good program, good people, they're trying, but it's inefficient, it's not good enough. So there's a good example. We could take the VA, which has some great characteristics. They actually have pretty good medical record systems. And we could make it into the, like you said, an envy of the world, show how it could work, and make it work better. But we're not doing that. We're rushing off to make more mediocre healthcare systems like the public option, which the public shouldn't want. By the way, the OMB revealed that the public option would cost more than, not less, than the current systems that are out there. So we're going to spend more money instead of less, which was what was promised by Pelosi and the gang. So I do think that we can make the VA, the Medicaid, and Medicare work better. My commitment would be, when people have paid into a system, they deserve to be, that commitment deserves to be honored. Medicare, the VA especially, and I don't think we're doing a good enough job as sort of stewards of that commitment, especially when Pelosi and the gang are cutting Medicare in ways that will be detrimental to seniors.